Hey, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at PetAbility Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of PetAbility. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them PetAbility sent you.
In meeting people from so many different walks of life, and we are all meeting together in our stewardship of animals, I just find these operations to do so much more than what we're seeing outwardly.
Welcome to PetAbility. I'm your host, Kathy Simons, certified veterinary technician, certified canine rehabilitation practitioner, and certified hospice and palliative care technician for pets.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Hey, Kathy. How are you today?
Hello, Chris, and good afternoon. Man, it is a beautiful day over here today, finally.
Yes.
Sun's out, nice breeze. Yeah, beautiful. Excellent pug weather.
I was going to say, we like to talk about the weather.
We haven't done it in a while because we actually had a meeting about not talking about the weather.
It's true, but it's a safe topic and it's a sign of how old we are.
I'm watching the Weather Channel now. Yeah.
Anywho, you know what we're talking about today and who our special guest is.
I do.
So today's topic is community medicine through the lens of a veterinary nurse with our friend and colleague, Marilyn Jerome.
I'm very excited about this. We have established an amazing group of clinicians that do consultations for MedcoVet and MedcoVet Luma. This is an amazing group, and I'm so excited that we get to be colleagues with Marilyn and that we get to hear what Marilyn has to say about her community medicine. I love when we do this with veterinary technicians because I think sometimes there's a misconception about veterinary technicians and their role in veterinary medicine, but it's very clear that we are the backbone of this industry. And I'm excited to hear what Marilyn has to say.
Agreed. I just had a conversation in one of our MedcoVet consultations with a nurse. She's retired from the human side of medicine. And we both were commiserating about unsung heroes, veterinary nurses and nurses in the human field. And it's backbreaking work. It's emotional work and really keeps the ship afloat. And she certainly agreed. And I wanted to give her the due accolades that she deserved. Yeah, let's get to it. And I also wanted to mention before we get to it that MedcoVet is our sponsor. So if you had the pleasure of listening to the introduction, and all three of us love working for this company. We think it makes a real difference. And so certainly check that out. But Marilyn is a fairly recent addition to our team. And Marilyn mentioned as an aside about her, past work in community medicine in New York City, and thought, wow, that is an interesting topic that I know very little about. And we always like to highlight, the different aspects of veterinary medicine and where opportunities may lie. And from my understanding, Marilyn was very instrumental in getting this up and running. So as I was insinuating, this is a compelling topic because it highlights both access to veterinary care and the often unsung, there's that word again, role of veterinary nurses and technicians in making high volume community medicine possible. This episode of PetAbility will balance Marilyn's personal experience, practical insights, and the broader impact of these programs. A little bit more about Marilyn's background. She is a licensed veterinary technician with over 25 years of clinical experience in veterinary medicine. Her career began with a decade of active clinical work in emergency and intensive nursing care. While at Blue Pearl Pet Hospital, she spent many years partnering with specialty veterinarians in internal medicine, oncology, neurology, dermatology, and critical care. A highlight of her career includes her key role in running mobile spay neuter clinics within the 5 boroughs of New York City, intensive high-level monitoring of ventilated patients, and the intake and medical operations of a rescue organization. And that's what we're going to hear more about today, of course.
She also holds a master's degree in health information technology. And we're going to talk a little bit more in depth about that as we go on into the show and how that plays a role in Marilyn's experience in assisting in the community clinics.
So welcome to PetAbility Podcast. We understand this is your first podcast, Marilyn. No pressure.
Welcome, Marilyn.
Thank you, Chris. Thank you, Kathy. I really enjoy listening to both of you. So I'm super excited to get to be a part of this today. A little nervous because this is my first time, but also really excited to share my experiences too.
We are too. We're excited to hear about this. And why don't we just jump right in to Marilyn? Can you share how you became involved with the ASPCA's Community Wellness Clinic in New York City? I know that you mentioned privately to Chris that this was one of your most gratifying endeavors professionally.
I became licensed in 2010. And for those 4 years prior to working with the ASPCA, I spent a lot of time just hands, in the dirt, working with intensive care and critical care and emergency patients. And I learned a lot within that time. And I think what can happen with a lot of technicians like myself, especially if we're working shifts where maybe we're working 3 to 4 days a week, we have some extra time. And I am a super ambitious person, and I wanted to see what else I could do. What else can I do to help? How much more can I learn? And I've always been interested in the spay neuter process and how it's delivered. I grew up in New York City, and the ASPCA has always been an organization that I've been very familiar with. One of my first dogs I was adopted from there. So when I found out that they were looking for a technician to help with the spay neuter operations, I was super interested and I knew it would fit my schedule. And that's how I got involved with it. And it was also an opportunity for me to really stretch my, anesthesia monitoring skills and doing all of that because, as I mentioned, I was 4 years out from graduating from tech school and I was just a sponge wanting to soak everything up. So that's pretty much how I got started in 2014.
Marilyn, we've bantered around this acronym ASPCA. Can you tell us what that stands for?
Yeah, the ASPCA stands for the American Society for the Prevention of Cruelty to Animals.
It's a national organization and one of the big players in the, rescue and animal advocacy industry.
Yeah, very much so, very much so. And now even more so involved in community medicine as the organization has grown and expanded. And
I was just looking up a little bit more about the ASPCA. It was actually founded, as you said, in New York City in 1866 as the nation's first animal welfare organization. So during what years were you involved with these clinics, Marilyn? Did you say that? When was this?
Yeah, so this was a short time period. It was just in 2014, and I was still a full-time licensed veterinary technician at Blue Pearl Pet Hospital. So I was working my full-time job, and I was doing the spay neuter mobile clinic on the days that I wasn't working. So I did it for a short period of time because, it wasn't sustainable for me to do it long-term. But it was still equally rewarding, even in the amount of time that I spent there.
Was anything in particular going on in New York City at that time that made these programs so important?
So 2014, apparently, and I didn't know this, being a New Yorker and living there, I think tourism is something that we just grow up seeing, and it's kind of a normal background of just, being in the city. But apparently in 2014, it was a record high year for tourism. And I was just thinking about this in relation to the operations because there was probably a lot of visibility, a lot of people that are not New Yorkers seeing these operations happen throughout the city in the five boroughs. And I'm sure that might have been inspiring for them to see. Another important event was Hurricane Sandy, which occurred 2 years prior, but there was still a lot of rebuilding, especially along the coastal areas in boroughs, a lot of rebuilding of houses. And, there was a lot that was lost for a lot of people in New York City. So the spay and neuter operations were very vital, I think, for those people that might have suffered financially, for example. And unfortunately, when it comes to our pets, I think we have to prioritize our children. We have to prioritize keeping a roof over our heads. And it created situations for a lot of people where they really didn't know where to turn to in terms of trying to figure out how to provide basic care for their pets. So I did also meet a lot of people that had suffered damage to their homes. And fortunately, they were able to get into the mobile clinic program. I know now the requirements for getting in are a little bit different, and we can probably go into that a little bit later. But Hurricane Sandy, that recovery period and the tourism, it was kind of a transitionary period, I think, 2014. There was a lot that was happening. I just remembered, I think Bill de Blasio, the mayor, also, he came into office in January. So that created another kind of transitionary period where the focus on equity in terms of people with lower socioeconomic statuses, maybe having a better opportunity to make more money or have a better situation was a conversation in a lot of homes too. So it just felt like a period of recovery and transition.
And I think these things tend to come around again, right? History repeats itself. And right now we're recording this on June 16th, 2026, and our economy is challenged, and a lot of people are in a similar situation with high gas prices and grocery bills and finding affordable housing and so forth. So, I know this is going to be informative for people of all walks of life and turning them on to, some of these resources even today.
Yeah, for sure. Yep.
I think it's extremely important. And I think that having access to these spay and neuter programs are fantastic. But what other services were offered, Marilyn, besides the spay and neuter surgeries?
So in addition to spay and neuter, if your pet needed their wellness core vaccines, like your, DA2PP combo, the FVRCP vaccines, we would do that post-procedure, nail trims, and also microchips. And kind of off the record here, there were a few pets that maybe they needed subcutaneous fluids or simple things like, little wound care or something like that. And we would throw that in back then. So, of course, these were only available to pets that were actually scheduled for the surgical procedure. So if you wanted to schedule an appointment for these basic wellness care services, you would actually have to go to the stationary community clinic and get that done. So the mobile clinic was really primarily for surgical procedures, and we would throw in these other services as well.
So I'm not sure I understood that there were brick and mortar community veterinary services that were permanent, and then you were part of the mobile efforts to actually get out in the community and reach those folks that maybe didn't have a means to get their pet to, right, I'm sure, the fewer standing practices. So
correct. Yep. Yeah. Okay. A lot of and this is something else that I wanted to touch on with the stationary community clinic. A lot of the pet owners and just, regular people that were involved in TNR or trap and neuter release programs, they would bring the feral cats or the stray cats and kittens that they found into those stationary community clinics to get them spayed and neutered as well. And just, other people that just live in the neighborhood or nearby could go into those community clinics as well. There weren't a lot of them, but they did exist. But as you mentioned, the mobile clinic was really instrumental in just getting out there, because there were a lot of people where maybe they lived a few blocks away from where the mobile clinic would be. Some people traveled, a little bit further, but for the most part, everyone was kind of from the general neighborhood or community area. So it just helps with people that maybe couldn't commute or would have difficulty doing so.
Access.
What does it look like, Marilyn, when you're doing these mobile spay and neuters? What does that look like? I can't even imagine the setup for that. Like, can you walk us through that? I can't even imagine the setup. Because I'm thinking about setting up for a spay in like just your general practice and how much room and space and instruments and autoclaves and stuff. Yeah. What does that look like?
It's a completely different world. And I'm so happy I had the experience, because I think I learned a lot about what it actually means to multitask and to be resourceful and to be able to kind of move around in a tight environment. Because so in the trucks, think of like a kind of like a galley, where all of the cages are behind you, and on the opposite side, you've got the treatment table set up, and it's a pretty long table and also a sink. And there's not much room. The team would consist of 3 people. You've got the veterinarian, a vet assistant, and the veterinary technician. And that's pretty much the whole team. The veterinary assistant typically did the driving. The vet would meet us there. And when you arrive in the morning, this would be around 7 a.m., a little bit before then, there's already a huge group of people that have been waiting. And one of the things that was really surprising to me, I think, as a New Yorker, is how orderly it seemed, because I think that New Yorkers kind of get a bad rap sometimes about, we're not the friendliest people and we're impatient and it's just not a kind environment to be involved in. But if you saw this group of people with all of their pets, they would create a list, and it's first come, first serve. So they would create a list and one person would be holding it and they're all just waiting in the morning. And it actually was not chaotic. I think if you walked by and saw such a big group of people, you might wonder how it's not, but it would never be chaotic. We would do the intake and check them in. And it's a very methodical sort of workflow where we are doing one thing after another, but keeping a good pace, because when it's such a high volume of patients and people, it's really important to have a good pace so that we can be done on time. And we also are accounting for incidental situations, like maybe we might have a pyometra or,
the little hernia, who knows, right?
Yeah.
You can't know until you get there. Yeah. How many are you seeing in a day? How many were you doing?
It depends on the size of the truck, typically anywhere from 20 to 25 pets.
Wow.
On a bigger truck, we could get to 25. And I think the most challenging thing, honestly, would be if it happened to be a day where maybe you've got like a 80-pound dog, an adult female that's got pyometra, and maybe you also have 3 really fractious cats as well.
Right.
And in a regular clinic setting, these are things we can take our time with, and we can let the, pet parents know we're going to need a little bit more time. But in this kind of setting, it's a question of, can we handle this in an efficient way? There's less room for mistakes, and we want everyone to be safe. And we also know that when you have a pet that's also anxious and fearful, and maybe they're aggressive because of that, you don't have a lot of opportunities to work with them, because if, you keep going, it just gets worse. So this is the part where I think the handling skills, understanding animal behavior, and being able to make good decisions really fast are important, because your whole day can get thrown off if, you end up spending 30 minutes, trying to pre-medicate.
Yeah. You get a patient you're like, oh no, this is an undescended testicle. That changes the whole, the whole course of your day. I can't even imagine in my head, how are you able to keep the sterility of that environment?
So there were sections where if you're entering the truck, the sterilization area is going to be toward the back of the truck, and that's where the surgical area is. It's all the way at the back. It's not an area that you would be walking past back and forth, and that's where the vet would be hanging out. And all of the pre-medicating, the post-operative care, the induction, all of that happens at the front of the truck. So it actually is not that difficult because it's sort of separate in a way. And once we know the pet's back there in the surgical area, there's no going back and forth or anything like that. As far as the anesthesia monitoring, that's a little interesting too, but somewhat easier in a sense because the procedures go by so quickly that they're not under for very long, honestly.
Fascinating. Marilyn, if I had like 4 spays in one day, I'd be like, 4 spays? Oh my God. We're never going to get lunch, right? It's 20 to 25 is incredible. It's incredible. Yeah.
You two are commiserating and using all these fancy words and I have to, give you props. I mean, veterinary nurses and or technicians are super smart people that are very dedicated to their work. But as you were alluding to earlier, Marilyn, like with the, like the large female dog and the fractious cats, again, in a typical setting, I mean, you can even physically separate those animals and give them all the time they may need to calm down, behaviorally and that sort of thing. But, as you said, that's not possible. So, in this particular setting. So I find that fascinating. So not only the medical piece of it, but like you said, the behavioral piece of it. And Kathy, you always like to talk about the emotional lives of animals. So, this whole fear-free movement that's going on now. And I'm sure you did your best to, not create stress or fear.
Oh, yeah. And that's the important part, and why I mentioned that you really only have about 1 or 2 chances to try to do what you're doing. And if you can't accomplish it, then it's best to just let the pet parent know that, we'll have to try again or bring them into the stationary clinic or something like that. But we never want to keep going. We don't want to, do a lot of aggressive restraint and all of that. Like that never happened in the truck. And I think the experience that I had working in the truck is really what helped me to become a better nurse, a better technician, because you learn how being efficient and being quick and, you get your shot in. And I hate to use that word, get your shot in, but if you think about bigger dog, maybe, and I'm going to use a specific example here. We had a female pit bull, and this is just an experience that, will always stay with me because of how well it went. So she was a large pit bull, an adult female, and I don't think that she's, necessarily an aggressive dog. I think she's just in an unfamiliar environment. She's in a cage, a lot of anxiety. And we realized that we weren't going to be able to handle her to pre-medicate her once she was in that cage. So typically what we'll use is one of those long poles, and we'll attach the pre-med in a syringe to the end of it. And you just pretty much have to stick it in and give them a little poke. It sounds like it's simple, but it's not always simple if you have a dog that's got enough room to, like move away from you and all of that. So being able to do things like that in a calm, kind of quick way and get them pre-medicated and then get them down, it's really important because I've seen how it can go the opposite way where if you've got anxiety and you're stressed out and you're just poking in different directions and you can't get in and they're just getting more stressed, the whole situation becomes way more stressful. And I'm a big believer that, all of the other pets that are in those nearby cages can hear what's happening too, right? So
absolutely.
There's really this importance in creating an environment where as the technician, as the assistant, as the vet, like we're all calm, we're fine. We can handle this. We're going to make it happen. And they can feel that. So we managed to get her pre-medicated, and she did end up being the pyometra case. But of course, the vets are awesome that do these kinds of operations because they are doing so many of these procedures every day. I feel like they can almost do them with their eyes closed, and it just goes by so quickly.
We've thrown out the term pyometra a couple of times during this interview. Can you just explain to the audience what is a pyometra?
Yeah, so a pyometra is basically, it's severe and it's life-threatening, but it basically involves a pet that has an infection that is in the uterus. And there are different kinds of pyometras, but for the most part, there's an infection in the uterus, and it can become very life-threatening because we know if bacteria enters our bloodstream, then that can lead to whole systemic infection. So when a pet has pyometra, it can become an emergency. And sometimes a lot of people don't even realize that that's developing until we get them into surgery, or they end up having to go to an emergency room because those signs start to show up.
Okay, my naive follow-up. Does pyometra only happen in intact females?
No. So, there are times where if a pet has been spayed already, maybe if there's a section of the uterus that remains and it's still there, that area can still get infected as well. And, you're dealing with the same sort of life-threatening situation.
But typically a spay would remove the uterus and ovaries?
Correct.
Gotcha. Okay. Marilyn, earlier in this episode, you had talked about who may qualify, right, to seek the services of these low-cost services. Can you elaborate a little bit more on that? I know you said it's probably changed, but what was going on at that time? Could anybody just walk in? Was it just an honor system, or did they have to apply?
When I was doing this in 2014, everyone would just show up and you'd put your name on the list. And I would have no way of knowing whether you were resident of New York or whether you were visiting from Connecticut. So it was a little more lenient in that sense. And I do know now that it's completely different, where there's not a list that you're filling out outside. You actually have to go online and you have to register and, be on a wait list, and you have to wait for that confirmation email that lets you know you're all set. You can head to the truck. So it's a lot different now. You have to provide proof of residency in New York. You've got to have a New York City address, photo identification, proof of public assistance, and all of that, where we weren't requiring that before. And I can understand why that's been in place recently. So
it's both location, like you're saying, residency, but also you had to prove that you were of low income to qualify?
Proof of assistance for a completely free service. So I believe now if you're receiving assistance from Social Security or disability, or you're getting food stamps, or even Medicaid, for example, you would qualify and be eligible for a free spay and neuter and just free services. If you don't have any of that assistance, you're still going to qualify for low cost care, but you would still need to be a resident of New York City.
Marilyn, why are there not more spay and neuter low-cost operations? Why aren't there more of them?
I wish there were more. And as I did some research into it, it makes sense. I mean, it's not impossible, but there's a lot that goes into creating an operation like this. I mean, if you just think about the legal aspects of it, like the licensing, the permits, making sure that you're staffed properly with experienced people. There's a lot that goes into creating a mobile operation like this, the startup costs and all of that. And I think it's not as easy as one would think, but I don't think it's impossible. And I also think that it is actually a really good opportunity for the areas of our country where, we call them veterinary deserts, right? Like the rural or even the low income urban areas. And these are areas where we really have a need. And I know I've spoken to enough pet parents where, they tell me I have to, drive an hour and 40 minutes or 2 hours just to find a vet that can help. Or I haven't gotten my pet spayed or neutered because I just can't afford it. And the only clinic that's nearby is just way out of my price range. And these are not people that are negligent or people that don't care, but this is the state of what a lot of people are experiencing in our country that are animal lovers. So I think it would be great to set them up in more places, but I do understand there's obstacles.
Right. And I think New York is very strict about their having the licensed technicians in practices. Yeah. So they're pretty strict, stricter than some of the other states, or stricter than Massachusetts. So yeah, I understand that. And I worry in veterinary medicine that we're pricing people out. I worry about that all the time. And you're right, these aren't bad people. These are good owners, but they just can't afford whatever it is that they had to have done. And that doesn't make them bad. So I would love to see the opportunity for them to get assistance.
Well, I do think that if folks are creative and determined, there are ways to do these things. Kathy, our friend and veterinarian that we both worked with and for, Dr. Beth Ennis, who we've had on the show a few times, she's gone to the central part of America and done community medicine, and she really loves it. And I know that they will set up their community center turns into this veterinary clinic for the time that these vets from all over the country come in and provide these services. I also know in the rural area that I grew up in Iowa, every year at our town celebration annually, they would do a free microchipping clinic. So even if you can only do a portion of these important services, but that was great because it helped dogs and cats get home again, when they may have gotten out and lost. And then finally, I was thinking about my friends that live up in Maine. They were working very closely, and I think on the board of their local rescue and shelter. And they did a great fundraising endeavor to get a truck because most of Maine is very rural. And so then that allowed them to go out again into these rural areas and the communities and so forth and have access to these services via that truck. So, I think it can take many forms, and anything that can be done is going to have a huge impact.
For sure. The other thing that I'd like to add is I think that I've been on both sides of the fence where I have worked in emergency and specialty medicine in Midtown Manhattan. And, I have worked on celebrities' pets, for example. I've worked on pets where they're just, their owners are very wealthy and cost is it's not an issue. And also, pets where maybe their owners have sold their car to afford their treatment. And even in working in that environment, still very rewarding because I'm still able to help animals that are in need. But being on the other side of the fence and going into these areas where, the socioeconomic status is a lot different, there's something very compelling about meeting people that are living in survival mode themselves, but they're trying to find any bit of money, any bit of help that they can to help these pets that are in their home. But not only that, they're going out of their way to take pets that are in their neighborhoods on the street and bring them home and trying to rehabilitate them and get them spayed. And they're doing all of these things while they themselves are in survival mode. And I have met just some of the most resilient, beautiful people. And I think that in our stewardship of animals, as we're doing everything we can to help them, what I found in working in these operations is that it made me love people even more. I became more connected with people in meeting people from so many different walks of life. And we are all meeting together in our stewardship of animals. So I just find these operations to do so much more than what we're seeing outwardly too.
That was beautifully said, Marilyn.
Yeah, I mean, this is why it'll always stay with me. And as I get older and I've got more time on my hands, I can definitely see myself doing more to get involved with community medicine and helping our pets, because I'm sure we know as well how overrun our shelters are and how it feels like it's kind of low on the priority list in our society, but it's still very much a need.
As you ladies were talking, it reminded me of that very famous quote by Gandhi: "The greatest of a nation and its moral progress can be judged by the way its animals are treated." And I firmly believe that. And I, like you said, Marilyn, oftentimes our animals and our pets don't take the priority that they may deserve. But I think when we all come together as a community and work as a team, there certainly is room for improvement and ways to effectuate that.
Absolutely. I met at least a handful of people that were involved in a TNR. And those people, I don't know, for me, like they always stuck with me because they're very dedicated. And I think I kind of touched on that, but I can go deeper into it. That they are, people that are working full time. They also have their own pets, and they're also finding the time to go out in the neighborhood and catch all of these feral cats that are running all around, and stray cats too. But it was the energy of these people and how dedicated and committed they were for doing this, and no one's paying them anything for it, right? So,
and catching feral cats is not easy.
no,
It's
no,
not easy at all.
no, it's
So difficult. Yeah, it's not easy. Marilyn, you wanted to tell this story through the lens of the veterinary nurse. Why is that perspective so important?
So I think this is a really important perspective because veterinary nurses, technicians, however you'd like to call it, we have always fought for more recognition, more compensation, and it's something ongoing that still exists today. And I like to think of us as the worker bees. And if you look up what the definition of a worker bee is, a worker bee is responsible for almost everything needed to keep a colony alive, right? I don't think that there's anything that I haven't done as a veterinary nurse. Whereas when we are, and I don't want to make this a comparison between veterinary technicians and vets because our jobs are different in a lot of ways, but I do think it's important to recognize how vital we are to the operation. And another analogy I'll put here is, the term a jack of all trades, but typically with a jack of all trades, you're a jack of all trades, but you're not a master at anything. But the really interesting thing with a veterinary nurse is that we become these jack of all trades that become very competent at a lot of things because we have to in order to create an operation that's actually going to be effective. So when you think about the mobile clinic and everything that we're doing, the vet is a very important and vital aspect here because they are performing the actual surgical procedures, right? But as a veterinary technician, we have to be sure that we are inducing our patients and making sure that we're doing it safely and properly. We have to make sure that we're keeping the actual truck clean and operable. We are doing post-operative recovery and making sure that pets who are recovering safely. And we're doing this for over, 15 pets, right, at a time. They're all recovering. And we know that that period of recovery can also be a very, it can be a dangerous period, like that recovery period. We need to make sure that they're all doing well. So there's just a lot involved in terms of skill, multitasking, thinking on your feet, moving very quickly. Also the physical aspect of it, the bending, the lifting, the holding, the restraining. I think of it as a veterinary nurse, every single part of your body is involved. Your heart, your hands, your brain, like every single part of your body is involved. And I think this is why in working in emergency and, intensive care for so many years, we really take the brunt. We take the brunt of the workload, and the burnout is just so incredible for us because we literally pour everything into what we're doing.
So the average life expectancy for a technician, or maybe not the life expectancy for staying in private practice, is 5 to 7 years. And so that technician that you love, that takes care of your pet, is probably only going to be there for 5 to 7 years. And people don't think of the aspect of all the other things that go into when you drop your animal off for a spay. Yes, the doctor is the person that performs the surgery. But when that dog or cat comes in, I do the intake, I do the lab work, I run the lab work. If there's pre-op x-rays, I do the x-rays, I put in the IV catheter, I do the pre-meds, I do the calculation, I do the intubation, I do the clipping, the cleaning, I get your vet ready, I get them prepared, gloved, gowned, open up surgical instruments, autoclave them. And that's just patient number 1 for my day. And then there's recovery. So if your pet is warm and your pet has recovered and they are comfortable and they are swaddled, that's us. And I'm not saying veterinarians aren't that person, but they have to go on to the next one too, right? And we have to be able to multitask and keep our eye on every single patient in this in this arena, right? And I'm so impressed, Marilyn. I'm so pleased to see that you had a master's, and I think that is amazing because we don't see a lot of veterinary technicians with their master's degree, and I think that that's very relevant to what you're doing. So yeah, kudos. And yeah, we're sorry, Chris, we're the warriors.
I know. I'm just honored to be in your presence.
You're honored to be in our presence. Yeah.
So I recently switched veterinarians to a vet that's a little bit closer to where we live. I've been going over an hour to continue to see their former vet who I loved and still love. But I was really impressed when I walked into the clinic because they had so many positive messages. And right where you check in and out, there was this big colorful sign that said, "Be kind to the vet staff." And, if that's not a take home message that I think our listeners should hear, I don't know what is, because as you each said, you are pouring everything into your profession to serve these animals. And Kathy, you kind of threw it in as an aside, but I do think that you do a large brunt of the client communication. I don't know how much time was available to do that with these mobile clinics, Marilyn, but that's huge, I think. And as far as aftercare and that sort of thing, and then just the teamwork. And Kathy, you mentioned Marilyn having her master's, and I know, Marilyn, you'd said earlier that was really important because you learned about workflows and managing to be efficient and so forth. So maybe we can elaborate on those points a little bit.
It's a good point that you brought up about my master's degree as well. And this was important for me because I did realize after a point, wow, I don't know how long I can physically do this. I'm in love with what I'm doing, but it just doesn't feel sustainable because of how exhausted on many different levels you would feel. So I pursued my graduate degree in advanced studies because I wanted to see how I could still affect some change and use my experience in a way where I could kind of step back in a higher level and help to improve workflows and just honestly learning about how the human healthcare field and how those workflows are organized and how projects begin and how patient care is prioritized and all of that. I took a lot of that and I compared it to how veterinary medicine operates. And I found a lot of similarities in terms of our veterinary technicians and human nurses, and the importance of teamwork and being able to deliver appropriate care, and how that care can be compromised if we're short-staffed, and just all of these things that go into actually delivering healthcare. And that was part of the reason why I wanted to continue my studies, because I wanted to just make a bigger change. And it's hard to do that when you're, heads down and you're a worker bee, because you're working and you're keeping things going. So eventually, in order to have a bigger impact, sometimes you do have to step back and do more delegating and take on a leadership role, and using your experience as a worker bee to help create better workflows, better for everyone involved, the patient, our technicians, our vets, and everyone involved, honestly. So I have learned a lot, and I'm hoping to continue to contribute in the field as much as I can.
As you were describing your roles and things like that, they're so varied and also vital. Would the vet be kind of like the hub of the wheel? Because they're doing, like you said, the procedure, the surgery, whatever it may be. But every single spoke that supports that wheel is the veterinary nurse.
There's nothing like a really great partnership between a vet and a veterinary nurse. I think that we can accomplish so much when those partnerships are really strong, because our vets, they have spent all this time getting their education and practicing medicine, and their job is to see a pet and to use their expertise to say, I think that this is the direction that we need to go in, and we need to carry out X, Y, and Z, and this is where we need to start. And you need a strong nurse to be able to carry out what your vision and your directions are, because as a vet, you can't do it all on your own. You can't have a vision and also carry out all these visions. So yes, so we have to be able to get the wheel moving.
It's about mutual respect too. I
Yeah.
think,
Yes,
between
course.
all parties involved,
Right.
obviously we all respect the veterinarian. The veterinarian should respect all the staff around, whether it's a vet nurse or the client care coordinator or the, person that's, checking out the client and the patient and the clients themselves. I mean, we all have to have a mutual respect for each other to have this flow the most seamlessly.
I would agree with Marilyn. When the relationship between the vet nurse or vet tech and the veterinarian is on point, the things that we can accomplish, with the veterinarians that I work, I can anticipate what their next move is because I've worked with them so closely. And I do love that. I love that so much. And I love that we be able to give each other that sort of mutual respect, right? That's great. When that teamwork works, it's on point.
Yeah, and it makes things even better for our pets too,
Right,
because if you're working for different vets, that different vets have different ways of doing things, and there's not just one way to do a procedure. There are different ways that it can be done. So when you really get to know your vet and they trust you as well, yes, you will anticipate what they need and how you can best assist them in doing that, and that actually can make a procedure go more smoothly.
Right. That this vet likes the curved Mets and bombs, and that
Yes.
vet likes
Yeah.
this retractor.
Here you go again.
There you go. But it does make things go smoother. Absolutely. Absolutely makes things go smoother. And that's to the benefit of all of the animals, really.
There's one other thing that I just remembered that I wanted to mention. It was a point that you made about, I think Chris made a point about the education for our pet owners.
Right.
And this was something else that is, number one, it's a big part of our job as veterinary technicians too, is the education part. But on the mobile clinic as well, this was a really, really important time because, again, we're dealing with, all different kinds of people. Maybe a lot of these people are not super educated on animals and how to take care of them, but that doesn't take away the will and the heart and the wanting to take care of them. So when they come to pick up their pets at the end, we go through a whole discharge piece where we're discussing what they should be looking for post-operatively that'll indicate that they're healing well. And we answer any questions that they have, and you get a feel for what kind of people these are and what they need, and specifically what their pets need, because there are, maybe things that we'll notice on the truck that are not emergencies and we're not going to address on the truck, but something that, their owner should be notified about. And what I found is that there are a lot of pet owners where they don't really know how to have a conversation with their vet to communicate what they can and can't do. And I've seen enough stories where they'll take their pet to the vet. They will pay for that exam. They'll leave with a treatment plan, and that's it because they just can't afford it. And they just think, well, there's nothing else I can do here. I don't know what to do. But these conversations we get to have with them open up their world to discuss financial resources of different things they can look into. I've had conversations where I've shared with people, well, why don't you communicate to your vet that you'd like to be as conservative as possible because, you can only afford this much. And, how can we maybe create another treatment plan that's going to fit my financial needs better? And I mean, this might seem like a simple kind of thing that anyone can figure out, but there are enough people that they don't communicate that, and they end up walking away without doing anything, without knowing, well, maybe we could have just done that and started with that, and that would have made all of the difference too. I think there are vets that are really good about seeing this, and they can have those conversations with owners and they can help them navigate that. But there, of course, are vets that, they'll give you the treatment plan, and if you can't do it, well, they've got to move on to their next patient. So the education part was really rewarding for me too, because I got to share information and you could feel that they felt empowered afterward. They felt like, okay, I've got a list of things that I can look into. I have a list of things that I can do and I can work with, and they feel more equipped.
I sometimes feel like they clients are oftentimes more willing to open up to the veterinary technician. And maybe I don't know why that is. And maybe there's a factor where maybe there's shame associated with it, or I don't know. But oftentimes we're the person that they come to with those concerns. And they should come to us. That's what we're there for. We're there for them. We're there to support that human-animal bond. And we're available to discuss these things with you.
Yeah. I think sometimes there's an intimidation factor, with veterinarians and medical doctors and professionals of all types. So if we open that door for that conversation, I think that that's fantastic. And so many things that can be done that are quite impactful, in terms of the overall health and well-being of that pet don't cost anything. It may just be a matter of informing and executing an action or preventing something that could be harmful from happening, whether it's post-op or just in life. And so it doesn't necessarily have to cost all this money. And I think I heard a while back that in vet school, the veterinarians are taught, their model is to present all the options and, without regard to cost or, what's feasible. That can be quite off-putting, I think, for a lot of folks. So I know we've talked about a lot of topics here, kind of on different facets of community medicine, but, also the importance and the role of veterinary nurses and technicians. And I really, really appreciate you taking the time out of your busy schedule to shed some light on that for our audience and Kathy and me. Thank you so much. So before we officially close here, Marilyn, is there a final thought, a message that you would like to leave our audience with?
Yes, the biggest misconception I think about these spay-neuter operations is going to be that the care is of lower caliber. And this is a huge misconception because the amount of expertise that's required in running these operations is just, it's really incomparable. When you have such a high volume of patients and you have to effectively, safely, and knowledgeably care for them, you really just develop a certain expertise that just can't be compared. I really contribute the development of my skills as a technician to the time that I spent working in these operations because there's so much that you have to do very quickly, efficiently, and correctly, that you really become very proficient at everything you're doing. And I would say the same about the vets that are involved in these operations too, from a surgical standpoint, because they're just doing so many. So no, these clinics are not of lower caliber of medicine. And I've met enough people that actually prefer to have their pets spayed or neutered on one of these operations because they know that everyone that's caring for their pet has done this so many times that, they're going to pick up on the slightest abnormality quicker than maybe someone else would.
I think that's an excellent point to end the show on. The degrees are the same. And, in terms of the degrees of professionalism and licensure and certifications and all that good stuff, it almost sounds like, Marilyn, that you are advocating that anyone that could participate in this sort of mobile clinic or community medicine should do so because you actually attained greater skills through that experience. And it's almost something that every person in the veterinary profession should be open to experiencing.
For sure. I definitely honed a lot of my skills there, for sure.
Thank you. This was amazing. What you've accomplished in your career is outstanding, and kudos. I'm glad and I'm happy to call you a colleague and to be able to work with you. You're brilliant. So thank you. So as we're wrapping up, just want to let the audience know if they're interested in having a free 30-minute consultation about red light therapy and the MedcoVet Luma, you can find me, Marilyn, Chris, and our friend Christy at MedcoVet. So check it out. Go to the website, fill out the consultation form, and you'll get one of the four of us. We can help you through navigating whether your pet's a good candidate for red light therapy and set up programs for them. So find us there at medcovet.com. All right. Thank you, Marilyn. It was great talking to you.
Thank you.
Thanks. All right. Bye.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at PetAbility Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you and tune in next time.